Good morning, everyone. We are the fourth group and we will be discussing about a childhood disability called cerebral palsy. My name is Roseanne and my group members are CJ and Faith. Cerebral palsy is a group of disorder that affects a person's ability to move and maintain balance and posture. CP is the most common motor disability in childhood. Cerebral means having to do with the brain, and palsy means weakness or problems with using the muscles. Your cerebral cortex is also called gray matter, is your brain's outermost layer of nerve cell tissue. It has wrinkled appearance from its many folds and grooves. Your cerebral cortex plays a key role in memory, thinking, learning, reasoning, problem-solving, emotions, consciousness, and functions related to your senses. The symptoms of cerebral palsy are movement and development problems, delays in reaching milestones, for example, not sitting by 8 months or not walking by 18 months, seeming too stiff or too floppy, weak arms or legs, fidgety, jerky, or clumsy movements, random uncontrolled movements, muscle spasms, or shaking hands or tremors. Management of cerebral palsy. The primary treatment options for cerebral palsy are medication, therapy, and surgery. The goal of cerebral palsy treatment is to manage symptoms, relieve pain, and maximize independence to achieve a long, healthy life. Cerebral palsy treatment is tailored to each individual to target and treat their specific symptoms. How to care for a child with cerebral palsy. You can be your child's at-home therapist, help them be active, help them expand their mind, focus on diet, keep a bright outlook, and get to know other parents. When you say home-based therapy, it is considered one of the most important because it can increase the amount of practice of a person with the cerebral palsy is getting. The more practice, the better. Movements, activities, and functional tasks helps the brain make permanent positive changes. And when it comes to their diet, you can give them eggs because it's a great source of protein and choline. Avocados, nut butters, olive oil, dark leafy vegetables, whole grains, Greek yogurt, and ginger.
Good morning, I am Clarson Jexalotamia. I am presenting to you cerebral palsy medication. Benzodiazepine are a class of drugs that can treat range of conditions. Doctors often prescribe them to treat anxiety, seizure, and insomnia. And then we have a high class of benzodiazepine. The strongest benzodiazepine, alprazolam, is the only high-potency benzodiazepine developed in an XR formulation. And then we have Keppra, a drug used to treat seizure, involuntary muscle movement caused by epilepsy, a group of brain disorders. Keppra is being studied in the treatment of services in patients with cancer that has spread to the brain. It is a type of convulsant also called levetiracetam. Cerebral palsy medication and side effects. Confusion, lack of understanding, uncertainty, seems to some confusion about which system does what. And then next, constipation or pagtitibe. A condition which is you may have fever, dysentery, bowel movement, and weak stools that are hard, dry, or lumpy. Stools that not or all stools that has pus. You usually can take steps prevent or relieve constipation. And then next, diarrhea or pagtatae. Loose watery stools, bowel movements, You have diarrhea if you have loose 3 or more times in one day. And the next, diazepine. Dizziness, or pagkahilo. Feeling faint, woozy, weak or unsteady. Woozy, I still feel woozy from all the pills. The next, flu-like symptoms or mga sintomas ng trangkaso. A group of symptoms that are similar to those caused by the influenza virus. Influenza is bird and some mammals, and it's the only species of the genus of the virus. The virus family Orthomyxoidae. And next, general weakness. What is asthenia? Asthenia, also known as weakness, is the feeling of body fatigue or tiredness. Kunwari, galing kayo trabaho, gusto nyong magbabad ng sapatos or magpalit ng damit, and then umupo kayo, gusto nyong tumayo upang uminom ng tubig pero hindi nyo na kinaya dala ng sobrang pagod nyo sa trabaho. And then, headache. A continuous pain in the head. We have 4 types of headache. Sinus, tension, migraine, and cluster. And then, physical therapy. The prevention, enhancement, or restoration of movement and physical function impaired by disease, injury, or disability that utilizes therapeutic exercise, assistive device, and the patient education. And the next, popular treatment and techniques commonly practiced today include acupuncture, a traditional Chinese medicine in which the needs are interested into the body. Aquatic therapy refers to the treatment and exercises performed in water to relaxation, fitness, physical rehabilitation. And then next, aerobic activities, cardiopulmonary, dry needing, edema control or dropsy, electrical stimulation, heat and cold therapy, and then hydrotherapy. Therapeutic application of water in a variety of ways, both internally and externally. And then, thank you.
What is the cause of cerebral palsy? So cerebral palsy is caused by abnormal development of the brain or damage to the developing brain that affects a child's ability to control his or her muscle. So cerebral palsy related to abnormal development of the brain or damage of the brain that happen during or before birth is called congenital cerebral palsy. So it can happen within a month after birth, during the first year of child's life, or before or during birth while the brain is still developing. So there are several possible causes of the abnormal development or damage of the brain. So some things increase the chance that a child will have a cerebral palsy. These are called risk factors. So it is very important that having a risk factors does not mean the child will have a cerebral palsy. So some of the risk factors for congenital cerebral palsy is low birth weight. So these are children who weigh less than 5.5 pounds, especially those children who were born less than 3 pounds. So they have a greater chance na magkaroon sila ng cerebral palsy. Ano pa? Premature birth. So we already know what is premature birth. So ito yung mga batang pinanganak ng hindi sakto sa 9 months. Okay. So children who were born before 37th week of pregnancy especially if they were born before 32nd week of pregnancy, so have greater chance of having a cerebral palsy. So, again, hindi lahat ng risk factors na ito ay itong risk factor na premature magkakaroon agad yung bata ng cerebral palsy kasi nga sabi nga, maraming possible cause kung bakit nag-damage yung brain or naging abnormal yung development ng brain. So, meron kasing pinanganak din na premature baby but normal sila. So, siguro hindi ganun ka normal pero siguro meron yung ibang rate ng development ganito, ganyan. So, hindi lahat. Next is infections during pregnancy. So, infections can lead increase in certain protein. So, iwasan natin na magkaroon ng infection, lalo na sa mother na nagbubuntis. So, meron tayong mga infections na talagang nakakahawa. Ang mga sakit na nakakahawa. So, ito yung German measles, yung rubella. So, this viral infection can be prevented with vaccine. Mape-prevent naman siya through vaccine. Pero, mas maganda i-consult mo sa doktor kapag nagkaroon ka ng ganun. Kasi nga, vaccine yun. So, merong possibility kung meron ng side effect, anong nangyayari dun sa ano. So, dapat mag-ano ka din sa doktor mo. So, ito lang yun, yung rubella, German measles. So, ito yung infections, nakakahawang sakit na once na kuha ng mother or kung hindi man, malapit sa kanya yung taong na to, magkakaroon talaga ng infection sa loob ng siya. Nalalantag na sa loob pa lang siya ng baby, nagde-develop pa lang yung brain niya. So, kung maaari, iwasan natin na mapalapit tayo sa mga taong may sakit habang tayo ay nagbubuntis. Ano pa? Herpes. So, ito din. This infection can be passed from mother to child during pregnancy, affecting the womb and the placenta. So, ayan no, itong herpes. So, meron din siyang risk factor din talaga. Paano nagkaroon talaga yung bata ng cerebral palsy, lalo na pag meron ganun ang mga sakit. So, ano pa? Yung Zika virus infection. Ito naman yung infection na nasa-spread through mosquito bites and can affect the fetal brain development. Mga risk factors. So, next is medical conditions of the mother. So, for your mother is may thyroid problems, possible na magkaroon ng damage yung brain ng bata habang siya nagbubuntis, or intellectual disability, or seizures, have slightly higher risk of having a child with cerebral palsy. So, ito yung mother, yung bata, is may sakit na, may disability na, possible talaga na yung anak niya din, paglabas, is may disability din yung bata. So, isa din yun. At kung merong sakit yung mother, like kung may sakit na chronic disease yung sakit ng mother, possible din talaga na magka-damage yung brain ng bata o kaya naman magkaroon talaga siya ng iba pang disabilities. So, birth complications, so detachment of the placenta, uterine rupture, or problems within the umbilical cord during birth can disrupt oxygen supply to the baby and result in cerebral palsy. So, yun naman yung during ng pagkapanganak mo and may nangyari na naaalog yung brain ng baby. So, possible talaga na magkaroon ng cerebral palsy. So, there are four main types of cerebral palsy: the spastic cerebral palsy, the dyskinetic cerebral palsy, the ataxic cerebral palsy, and the mixed type cerebral palsy. So, what is the spastic cerebral palsy? So, this is the most common type of cerebral palsy. Spastic means the affected muscles are stiffer and tighter than normal. So, how stiff the muscle is will vary from person to person. So, this is a form of hypertonia or increase of muscle tone. So, this results in stiff muscles, which can make movement difficult or even impossible. So people may have difficulty moving from one position to another. So, and controlling individual muscles or muscle groups needed for performing certain tasks like handling objects or speaking. So there are three types of subtypes of spastic cerebral palsy. So spastic cerebral palsy may be classified as quadriplegic, diplegic, or hemiplegic according to how and where it affects the body. So, sa quadriplegia spastic affects both legs and arms. So, it also affects the muscles of the torso and face. While the hemiplegia spastic affects muscles on one side of the body, either right or left. In most cases, the arm is stiffer than the left. So, kahit po saan siya, kung saan yung part ng body. So, kung ito yung brain and ito yung na-damage, so si right brain, yung part ng right, maapektuhan po is yung left natin. Pag dito naman po tayo sa left ng part ng brain, maapektuhan po is yung right. So, next is diplegia. Spastic diplegia occurs in the legs. So, in some cases, it causes mild stiffness or spasticity in the arms. So, now, let's proceed to dyskinetic cerebral palsy. So, what is dyskinetic cerebral palsy? In this type of cerebral palsy, the muscle tone can suddenly change from high, tight to low, floppy, causing uncontrolled involuntary movements or spasm. So, we already know that brain is very important sa atin. Kasi it is like, if your body is a computer, your brain is the main frame. So, it controls everything. So, once nasira po talaga yung brain or may damage at ibang part ng brain, maaari pong magkaroon ang hindi magagandang pagsisend ng brain sa parte ng kanyang katawan. So, okay. Dyskinetic cerebral palsy is the most common, and early warning signs are delays in certain developmental milestone like sitting up. So, pag yung bata po, meron po tayong tinatawag na mga age. So, meron pong age na may specific na age kung kailan makakapaglakad na siya or makakapag-crawl na siya. So, pag yan naman po ang nangyari is delay na, which is tatlong taon na hindi pa rin naglalakad or tatlong taon na hindi pa rin nagsasalita ng kahit anong words. So, possible po na meron siyang cerebral palsy na tinatawag ng dyskinetic cerebral palsy. So, next is the ataxic cerebral palsy. So, what is the ataxic cerebral palsy? So, this is the least common type of cerebral palsy. Movement is often shaky and balance can be poor. So, this is characterized by problems with balance and coordination. So, these issues are caused by the damage to the developing brain's motor and motor control centers. So, ataxic cerebral palsy is caused by brain injury to the cerebellum before, during, or shortly after brain. So, children with ataxic cerebral palsy have a hard time controlling their movement. So, they are shaky and struggle with precise movements. So, kagaya na lang ng pagsusulat, ng pag-grab ng mga small objects. So, ataxic cerebral palsy can affect the hands, arms, legs, feet, and even yung speech nila, yung pagsasalita nila. So, na-apektuhan din. So, next is the cerebral palsy. So, ano ba itong cerebral palsy? So, ito yung types of cerebral palsy features of more than one type of cerebral palsy. So, yung bata, hindi lang na siya merong dyskinetic, meron din siyang spastic. So, kaya tinatawag na mix. So, pwedeng spastic dyskinetic cerebral palsy o ataxic dyskinetic cerebral palsy. So, hindi lang isa na type ng cerebral palsy meron yung bata, kundi dalawa or more. Kaya tinatawag siyang mixed cerebral palsy.